Good evening. You're watching the India Development Debate. I'm Tamanna Inamdar, and we have a power-packed show lined up for you this evening. First, we're going to take up the case of our angels in white, our doctors, our medical workers. This is something we've addressed earlier as well, but there are several medical workers who are still forced to be on the front lines of this battle with COVID-19 without adequate personal protective equipment, and that is just wrong. We're taking that issue up first on the show. We have a special guest today, Shamika Ravi, who's from Brookings Institute and also former member of the Prime Minister's Economic Advisory Council. And we're getting you a big market voice today on a day when the markets seem to be immune to the COVID-19. So all of that lined up. But first, let's talk about our frontline heroes. They are literally risking life and limb to treat and fight back the battle against COVID-19. But many in different parts of the country, and I'm talking about medical workers here, not just doctors, nurses, several people who work in this industry who do not have the right equipment required to ensure that they don't get sick, which is why you've been seeing more and more cases of medical professionals more vulnerable. In fact, the WHO also says that medical professionals are some of the most vulnerable to contracting the disease because they're at the forefront of all of it. The recent incident in a major hospital in Mumbai, Wockhardt Hospital, again highlights the issue quite starkly. We're seeing that in fact in many major hospitals across the country. So where are we lacking? Why aren't we able to provide PPEs in the right amount, the right kind to our medical workers, and why is that not the top priority? To speak about that this evening, I'm joined today by Viren Shetty, who's the COO of Narayana Healthcare, and I'm also speaking with Dr. Jalil Parkar, who's a senior pulmonologist at Lilavati Hospital. Welcome to both of you, and thank you for speaking with us today. Dr. Jalil Parkar, let me get a sense from you first about how acute the issue really is at this point.
You mean to say the acute issue is regarding the equipment, etc., and the PPE that is being used by the medical staff who are on the front line?
Lack of PPE for our medical workers. Yes, absolutely. Yes, absolutely, right. Dr. Parkar.
Let me begin right from the let me begin right from the beginning. See, since this illness has been new to everybody, we were not that well equipped and nobody knew as to how to go about it. But as the days have passed by, we all are slowly streamlining. Like in the initial stage, yes, of course, there was shortage of gloves, there was shortage of COVID-19 masks, there was shortage of the PPE, but somehow we managed, and because of that shortage, most of our medical personnel, whether it is the doctors, the junior doctors, the consultants, the nurses, the ward boys, we had to limit them into taking care of these patients because there was shortage of equipment. But slowly over a period of time, I think things have improvised, and we find that we are no more in shortage. On the contrary, we are able to give full protection to our doctors, nurses, paramedics, everybody, ward boys, etc. Now, having said that, the question will be whether we are talking about the quality standards. Now, let me tell you very upfront that we as medicos, we are not
Dr.
into...
Parkar, Dr. Parkar, which hospital specifically are you talking about? Because we are seeing cases even from major hospitals in Mumbai and Delhi where, you know, your medical workers, perhaps not your top doctors, but your medical workers are complaining that they don't have PPE. I know of hospitals in Mumbai which are falling short, and people are desperately trying to get them that equipment. Do you really feel that there is 100% coverage right now? Because there is evidence to the contrary.
Well, I'm talking about the hospital in which I am because I'm on the front line. So I can tell you that yes, all our staff are getting those PPEs, but there could be a shortage elsewhere. And I'm not aware of that because we are not into the procurement of it. But yes, as you rightly said, we do hear that there is shortage everywhere, and it must be in satellite cities or primary health centers, etc. But in our hospital, I think we have taken care of that. Now, how they've managed to get these through
Fair
the
enough, Dr.
wholesalers, the
Parkar.
distributors, how
You
many
you are
distributors,
with
that
a
I am not aware of.
top hospital in Mumbai, so that's exactly. Exactly. So you're with a top hospital in Mumbai, which is excellent to hear that this hospital is completely covered. That may not be the case across the country, and it seems it's not. When I'm talking about people, who need to be protected, that goes to every village, every town, and every level of medical workers. Let me welcome Dr. Yatin Mehta also to the conversation. Dr. Mehta, how do you look at this situation? And I'm not, of course, talking about any particular hospital or your hospital. Of course, you're with Medanta. I'm saying in general, what is the situation? Because we're hearing about anecdotes about young doctors, interns sometimes, whose parents and families are frantically trying to find vendors so that their family members can go and serve without being infected themselves. It's literally sometimes like sending a soldier out to war without any ammunition or armor.
Absolutely, Tamanna. I think realistically speaking, there is a shortage of PPEs in India. Not only in the government sector, but in a lot of private hospitals also. More so in the peripheral hospitals, less in the metropolitan major tertiary care private hospitals. Okay. But there is a shortage. India, we never paid attention to start with to PPEs because we never thought that we'll be faced with such a horrendous situation. So, PPEs, there is a shortage worldwide. I was talking to some friends and colleagues in US, in Italy. They're also reusing their PPEs, and there is a shortage there also. And now, unfortunately, China is in a position to export it or to donate it to the countries which are short of it. So there is no question there is a shortage. Government and the private organizations are doing their best to jack up their manufacturing capacities, but this is not going to happen overnight. Fortunately, at the end, when this all ends and we look back, we will realize what were our shortcomings, and maybe we'll be in future able to export these things to the rest of the countries. But at the moment, there is a crisis. N95 masks, which is the requirement for people who are directly treating these patients. There is not enough supply. Even the American hospitals are reusing the N95 masks. So we also have to figure out. Today, I had the infection control committee of the hospital, so I have instructed all the doctors and the staff which PPE is required for what procedure, in which group of patients. Everybody doesn't need to be fully protected in the armor suit. Only the people who are directly treating these patients need to be fully this thing, and we have to grade it accordingly. So we don't have to get too excited about the PPEs, but the right people should be using the right PPE, and all of us should work towards making sure that you get what you need. So, as you rightly said, one should never go to the war without proper equipment, and that is what I tell all my staff. Please wait for the right PPE. If there is a little delay in delivery, do not go in, because lives are precious, patients' lives are precious, and so are the doctors and the paramedic staff's lives.
Absolutely. I'm not sure if every medical center is giving that choice to their workers. Where, of course, right now on my screen, I'm talking to people who represent or work with top medical facilities in this country. And let me go to Viren Shetty for his point of view as well. Where I'm sure at your end, to the extent you can, you've managed it. But remember, Indian healthcare is not about the big branded hospital chains itself. Those are a minuscule part of the entire setup, and everyone needs equipment and protection.
Yeah. No, absolutely, you're right. Every hospital does need protection, but there are certain practical facts that you need to consider. One is this is a fast moving disease, and we had no idea about the scale of how it would spread across the country. The government first placed an order for PPE kits. They ordered 7 lakh pieces. Assuming that this was something that would not be a big deal, they placed the order 2.5 months ago. Once it became clear that this was going to be more serious than we thought, they placed an order for 6 million kits. Now, there aren't enough companies in India that are able to scale up that quickly. And the only avenue for that, which is China, were to face a global supply chain shortage, as well as that we are outbid constantly when it comes to other hospitals, other more advanced parts of the world who can always outbid Indian hospitals and the Indian government for getting these kits. Now, I agree that in the smaller towns, there is a huge problem of PPE, but there are a lot of practical issues you have to consider as well, which is that small town hospitals where they don't have proper infection control protocol, where they don't have ventilated ICU beds, where they don't have constant 24-hour oxygen supply, really should not be treating COVID positive patients. And a PPE kit is not a joke. It is a very thick laminated fabric. You can last at most 4 hours wearing that. Then you need to go through a complete decontamination procedure, and then you need to change the shift. Small hospitals don't have people working on 4 to 5 shifts a day. They don't have the workforce. So that's why we had recommended to the government that COVID patients have to be treated in centralized COVID hospitals. But of course, the small hospitals are suffering now because patients don't always know they have symptoms, and patients don't always disclose their travel history. And so a lot of the times where you see outbreaks happening in hospitals, it's from inadequate disclosure from the side of the patients to tell that I am possibly an infected patient, therefore you need to treat me separately.
Well, in some cases, it's a lack of disclosure. In a lot of cases, really, in some cases, perhaps the patient also does not know. The question is, what are the solutions? Viren, let me come to you for a follow-up. Right now, you have a lot of companies being pressed into manufacturing PPEs that are not, are traditionally maybe in some other business. You've seen those in the garments business, etc., pitching in and coming in. But do you think that there is going to be a very real time lag before they start producing the kind of equipment which meets the benchmark, because they have no experience doing it?
I agree. See, the requirement is 6 million kits. And if you, as a factory, can do about, at most, if you scale up, even someone at the scale of Aditya Birla would not be able to do more than 20,000 kits a day. So for a 6 million pieces, you're going to take 300 days. That's a whole year to take care of it. So there is a lag, but that doesn't mean that every single healthcare worker out there needs to be equipped with a PPE kit. Sometimes all you need is proper protocols and discipline, right? With adequate separation, with adequate disclosures, if we're able to separate out healthcare workers and be able to triage patients properly, there'll be much lesser need for the PPE kits up front, and so we have enough time to prepare the health systems until large numbers of patients start coming in, and then these COVID positive ICU beds will have patients, will have doctors equipped fully with the personal protective gear.
Yeah, the question of PPE kits is, in that sense, similar to the whole controversy we've seen today about the anti-malarial drug hydroxychloroquine, I hope I'm saying it correctly, which now has become a bone of contention. So as nations try and figure out what they need, and they figure out globally who has that material and who doesn't, everyone's trying to hoard their own supply or keep the maximum for their own people. Dr. Mehta, I want your take on this. Of course, the context to this is, for our viewers, the US President Donald Trump today making a statement where he seemed to say that India has agreed to provide these tablets, these anti-malarial tablets, and it would be a big problem for us if we didn't. It was taken as a threat, and of course a lot of responses and back and forth has gone on it. But I want to come to the key issue, Dr. Mehta, about how the world is now going to have to scramble for these things. And how does a nation like India ensure that we have adequate supply, whether it's of this particular anti-malarial drug, which may be used to protect, many, including medical workers, whether it's PPEs, whether it's ventilators?
See, this is the time for us to actually realize our potential, because we have huge manufacturing potential. And this is the time when we realize our weaknesses also, that we did not have enough PPEs. So this is the time when we can get on to the thing we have enough wherewithal to manufacture these PPEs, and we can catch up on this, and then we can export it in future. Also, this is the time for the world to realize that we are the kings of generic manufacturing of pharmaceuticals. So if US has to request us or threaten us, whatever you call it, for hydroxychloroquine, the world should realize that we are capable of making hydroxychloroquine to supply to any part of the world. So this is the time for to get our act together. Obviously, Donald Trump's the way he put it was not correct. Any self-respecting Indian would feel that this is not the right way to request somebody for help. I mean, they have a pandemic, we also have a pandemic. So obviously, we'll have to look at our own requirements first, of either PP or hydroxychloroquine or whatever you require it. First, our requirement should be fulfilled. Only then we'll be able to help or send somewhere else. So that's a given. But this is the time, I mean, when China is exploiting the situation. China has started exporting the PPs all over the Western world. So this is the time, in the next month or so, when we can get our act together. PPEs is not rocket science, and we can start manufacturing and in future start exporting also. But at the moment, our priority is, please, we must support our medical staff with the full protection which they require to go in for the battle.
No, absolutely. I was speaking with someone yesterday who actually said that it should be considered criminal to force medical workers to work without adequate equipment. Again, I'm not speaking about any of your organizations. I'm sure, all of you are sticking to the best standards, but that's not necessarily the case evenly across the country. So Dr. Parkar, let me come to you on the question of hydroxychloroquine and the demand that the US has made. We've now seemingly relaxed our export policy to be able to give these drugs. Is there any concern in the medical fraternity about the availability of this medication and how it could be used and why it's so necessary at this point?
See, firstly, I would agree with my colleague who just said that the way Donald Trump has asked for this medicines from us, it's very unprofessional and uncouth of him to, demand it from us. Now, having said that, if you are talking about SCQs and also of azithromycin, this is the first time this illness has taken place all over the world. There is no research or there is no documentation where there is a controlled study of SCQ on COVID-19. So, since it has been given all over the world and people are saying that yes, it is because of SCQs and because of azithromycin that people have turned around, I personally feel that that is questionable. Now, SCQ also has one of the side effects in which there is QT prolongation, which is not good for the heart. People are of the opinion that yes, we should go, and those protocols are being followed in most, because that is the instructions that have come from the health authorities, and we are following that. But is it really helping is the question. Now, this you will come to know maybe 2-3 months down the line when there is a control study done and when many of the patients have taken this, and then once you know that it is really helping, that's a different issue. But at this juncture, I think it is quite questionable. Many of my colleagues have taken XCQs and many of them have not. Even in the US, I have spoken to many of my classmates who are in Chicago, some are in Cleveland Clinic, some are in Harvard. They themselves have not taken. So I think the patients who are really symptomatic, I think they should give it a try, but not the patients who are asymptomatic or it's just on an OPD basis where they have just cough, cold, body ache, headache, fever. I don't think they should take it unless you have respiratory symptoms, unless your saturation is down, you are admitted into the intensive care. I think those patients should take it. But anyway, it's highly debatable.
No, and just to reiterate here, time and again, the Health Ministry and the ICMR has warned against self-medicating with this particular drug. It could have some really drastic side effects. So just putting it out there very important not to confuse people about what medication they should take. But Viren Shetty, I just want you to come in on the larger point I was making, whether it's this particular drug, the anti-malarial drug, or it's PPEs, or it's ventilators. There is now a huge demand for these things across the world. How do you think India is poised in terms of having all of this equipment? Because we are going to need more and more of this over the weeks to come.
Yeah. See, it is very sad that there's been a complete breakdown of the global world order, where countries that should have been responsible are not being responsible, and everyone is basically in it for themselves. There are stories you hear about US buyers coming into the runway of planes that are bound for France, ready to take off with a plane full of PPE gear, paying cash on the spot and diverting the supply. Now, when this kind of trust doesn't exist in the world, it's every man for himself. So rather than whine about it, what has happened is Indian industry has really taken up this challenge. For the longest time, there wasn't much of a market for PPE for disposal fabrics in India. We completely relied on China, and there were very few Indian companies that were able to take care of this. But now the need has arisen and companies have taken it up. So one of the biggest success stories was the textile ministry really putting very proactive steps and gearing up the industry that have a lot of shuttered garment factories right now and converting them into making masks, converting them to making caps, PPE gear. As regard ventilators, industry has stepped forward. Tata, Mahindra have all started working with companies based in India to help them rejig their supply chain and increase the output of the ventilators that are required. It's obviously the best time to have done this would have been last year or the year before that, but the second best time is right now. And so we have taken this up. I see long-lasting changes from that. It's going to spur Indian innovation in a really big way, and I hope that this teaches us the importance of building up a very strong local market and the ability of hospitals, if they support local industry rather than favoring multinationals, it will really spur a lot more investment into India and Indian companies. And the next few years are going to be extremely exciting for Indian manufacturing in these products that you mentioned.
Well, absolutely. Right now, it's a little tough to look at the next few years. We have to get through this crisis first, but I'm sure this too shall pass. Meanwhile, I think we need to give a strong message to bullies who think they can arm twist us into getting the equipment that we may desperately need as well. I want to thank all of you for joining us on the first discussion right here on the India development debate. And just to remind, all of us need to be protected. So please do watch out for this Times Network campaign of making your own mask in a way where you can be safe every time you absolutely have to step out or even at home. Well, while the world is frantically looking for a cure to COVID-19, looking for vaccines, etc., it seems like the Indian markets found some immunity to the global pandemic, which has wrecked valuations over the last few weeks. Investors got richer, or I would say recovered their losses by about 7.86 lakh crore rupees today, the highest daily percentage jump in the markets since 2009. And the Sensex ending above 30,000 for the first time in 3 weeks. Let's go across to ET Now Managing Editor Nikunj Dalmia to understand what's going on. Nikunj, what's the magic mantra that the markets have found?
You know, we are living in interesting times, we all know that, but I never thought as a market commentator I would be using phrases like panic sell-off and fear of being left out. So panic and FOMO is something I've used perhaps couple of times in last 15 days, and it rarely happens. You don't see this kind of an panic and this kind of an comeback. So we are indeed in interesting times. I guess today's market action can simply be summarized in one word. Markets rallied because of medical news. So there is hope, there is a belief, there is a view that the number of cases in Europe are plateauing. The number of recoveries in France and Germany are increasing, and the number of deaths in US are reducing. Now you combined these three factors up, and then if you ask a market commentator react to it, I think the markets have reacted to that today. Now I don't think markets today really was in any mood to consider yes or no about the economic package or what will happen to lockdown. That was all secondary. We had a long weekend. US markets rallied on Friday night. The handover was decent on Monday. We got a good cue from Asia this morning. It was a gap up start and bulls were able to build on to that gap up start. Having said that, while today we are celebrating what could be called as one of those biggest surges in the market, and it is coming on genuine good solid global cues, nobody can definitely tell you that how and when markets are going to be turning. We are, like I said, in interesting times, and markets would completely be hostage to medical news. I'm hoping, I'm praying, all of us are sincerely hoping and praying that on the medical front, let's hope we see an improvement. So that's for me was the key reason why markets really went up, and they went up like a rising tide which took all ships up. That's one. Secondly, what I see happening now is that maybe in a day or two, maybe this week, by next week, markets will start differentiating the boys from the men. The wheat will be separated from the chaff, which means that companies, consumer brands, balance sheets, and companies which have ability to grow in this difficult time will be rewarded disproportionately. So for me, that is the fundamental moment when I will logically say that markets are going because of logic, not because of a rising tide phenomenon or medical news or short covering.